Middle of April, I was playing golf with my dad and one of my dad's college roommates. And I'm climbing out the lip of the bunker to go back to the cart to get my putter. And all of a sudden I'm like, I can't freaking breathe. So I sat in the golf cart to catch my breath, and I got my breath back and walked to the green. I bent over to mark my ball on the green. I literally almost fell over and passed out.
We knew he was sick. We knew something was off. When I tell you I know his breathing, like I know. And I said to him, we really need to call the doctor. The 28th is the day we go to Sloan, and I said to the nurse, I said, he needs a CAT scan. She's like, well, we'll do an X-ray. I said, no, he needs a CAT scan. Something's off with his breathing. You gotta figure it out. And we come back, and he was in there for a while, and I'm thinking, this isn't good, something's up. So of course I immediately start texting Kevin and hospital, and I'm like, what's going on? And they're like, just keep us posted. They come out with him, and they're like, we have to go back to see the doctor. That never happens. We never do that. So I'm like, this is really bad. We walk in, she goes, you two need to sit down. She goes, he has a large pulmonary asthma. Like,
she said, you're lucky you're not dead.
She goes, we can't understand how you're not dead. And that's when I called Greene and I said, okay, we're ready to go. What are we doing? He was just telling me that he met Dr. Lyle, and she was able to save a guy who had a tumor on his spine, and she started her treatment on him and saved him from that. We meet with Dr. Lyle, and she explains exactly what we're gonna do. We start the integrative oncology. We go out June 1st. We were there for 4 days a week for 7 weeks. She said, this is a war, and we're gonna win. He gets an IV in one arm. They take the blood, that's the bad blood, out of one arm. They filter it in a big square EBU machine. Then after it's filtered, they put it back in. And we saw the difference in the blood. If Dr. Greene wasn't proactive, he would not have been as strong as he is. I truly believe that, because who else makes it through a pulmonary embolism? Like literally, he did not look like this 7 weeks ago.
You know, we owe it all to Kevin. He's always looking for like the next best thing to help his patients.